are going to look at the various parts of the bones, a long bone in the beginning. You see, a long bone will have a shaft which is called as the diaphysis, and if you're talking about the ends, they are called as epiphysis, which can be multiple in number, maybe on this side or that side. So shaft is only one, and epiphysis can be more than one. As you see, the ends you have epiphysis, and the shaft itself is diaphysis. Diaphysis embryologically will come from primary center of ossification, whereas the epiphysis come from secondary center of ossification, which usually appear after birth, whereas primary appears in the 6 to 8 weeks of intrauterine life. What about the metaphysis? Metaphysis is the epiphyseal end of the diaphysis. What is that? It is the epiphyseal end of the diaphysis. You mean to say metaphysis is a part of the diaphysis? Yeah, it is. Metaphysis is a part of the diaphysis, but towards the epiphysis. That will be metaphysis here. What about the embryology? Actually, it is appearing at a place where you had growth plate during development. So during development there will be a growth plate which will be replaced by some bone, and that bone will be called as the metaphysis. We'll see the development in a short while then. As you are moving into the other diagram, which is a section taken, you see the ends, they have spongy bone, cancellous bone. And if you are talking about the shaft, then it has compact bone. Though the compact bone is at the periphery, there is a bone marrow inside, and there it is surrounded by some cancellous bone. So basically, cancellous bone or spongy bone is at the ends and also in the near the bone marrow, but if you're talking about the shaft, it is mostly cortical bone, the compact bone. Now, as you talk about the development of bone ossification, there are two types. One is the endochondral. Most of the bones in our body will develop endochondral ossification, though if you're talking about few of the skull bones, especially the skull cap. So if you're talking about the skull bones, few of them, especially the skull cap bone, they are developing in membranous ossification. Otherwise, most of the bones develop in endochondral ossification. See, you have to understand, most of the bones may be the appendicular skeleton, upper limb, lower limb, or the vertebra, ribs, or base of the skull. This is all endochondral ossification. The bones are developing in hyaline cartilage. There's a hyaline cartilage model, and that hyaline cartilage model is then ossified, endochondral, inside the cartilage, inside hyaline cartilage. And what about the few skull bones? The skull cap. The few skull bones or skull cap have membranous ossification. Even clavicle bone is partly developing in membrane. So clavicle bone also has membranous ossification partly, and partly it is endochondral ossification for clavicle. Skull also. If you're telling the skull cap, it is membranous, but the skull base will be endochondral ossification. So what is the further information? You see, as we are telling, if it is this skull cap, which could be parietal bone, is intramembranous ossification. But if you are looking at the base of the skull or other bones, maybe vertebra or the ribs or the upper limb, lower limb bone, humerus or femur, they are all endochondral ossification. And as we suggested earlier, there will be a primary center of ossification, which is 1 in number and appearing intrauterine life. 6 to 8 weeks of intrauterine life. That is the one which is going to form the shaft of the bone, because the ends of the bone will be ossified after birth usually. Secondary center of ossification appears after birth. This is primary center. You see, when we talk about endochondral ossification, we are going to draw a diagram, but before you draw the diagram, you should see what we are supposed to draw. And here, This is the one which we are going to follow. In the beginning, most of the bones will have a hyaline cartilage model, which will be undergoing ossification to form bone, and it is called endochondral ossification. So this hyaline cartilage model is developing some primary center of ossification, which is in the 6th to 8th week of intrauterine life, and that primary center of ossification is going to form the shaft of the bone, diaphysis. If you are talking about the diaphysis or shaft of the bone, that would have come from primary center of ossification, which appear before birth. And what are the secondary center? Secondary center of ossification usually appear after birth, and what do they form? They will form the epiphysis, ends of the bones, which can be multiple in numbers. So when you're talking about the ends of the bone, there can be multiple epiphyses. Now, as we proceed further, we are telling that almost all the hyaline cartilage will be changing into bone, but there is still some hyaline cartilage persisting, which is called as the growth plate or the epiphyseal plate. Now, this growth plate or epiphyseal plate also, after some time, it will disappear and replaced by some bone which is called as metaphysis. So metaphysis is the newly formed bone which is coming in place of the epiphyseal plate. In fact, after some time, all the hyaline cartilage is gone and it has changed into bone. See, epiphysis plate or the growth plate is gone and some line is there. No more hyaline cartilage evident, only epiphyseal line is evident. But remember, maybe you are telling that all the hyaline cartilage has become bone by endochondral ossification. Still, some hyaline cartilage is persisting at the ends of the bone, forming the articular cartilage, and articular cartilage will never ossify. Articular cartilage, there are questions asking some details. First of all, articular cartilage is at the ends of the bone to make the ends of the bone smooth for smooth movement at the synovial joint. You want smooth movement at the synovial joint, end of the bone should be smooth, lined by hyaline cartilage, which is articular cartilage. And this articular cartilage will never ossify, never become bone, and during aging it may undergo osteoarthritis. Osteoarthritis means degeneration of the articular cartilage, then formation of some osteophytes. Now, as you draw this diagram, it will be in 3 stages. You will tell that we are first looking at a baby intrauterine life, baby after birth, and then one adult situation. So when you're talking about the 3 stages, first of all, you tell there was a hyaline cartilage model. And in this hyaline cartilage model, this is the hyaline cartilage model. In the intrauterine life, there is a blood vessel bringing some cells, osteogenic cells, and forming primary center of ossification, 6 to 8 weeks of intrauterine life. So some blood vessels have come bringing some osteogenic cells. As you're talking about intrauterine life, that is week number 6 to 8. Week number 6 to 8, there is a primary center of ossification, which is actually some osteogenic cells brought by the blood vessels. And what is this primary center of ossification going to form? The diaphysis, shaft of the bone. You see here, it is going to form the diaphysis or shaft of the bone. Now, if you say this is going to be the diaphysis or shaft of the bone now, which would have come from the primary center of ossification, still you have got some hyaline cartilage. And that hyaline cartilage is the growth plate. That is the growth plate. Now, if that is growth plate, this is also growth plate, which is also called as epiphyseal plate. What else do you see? I see some ends of the bone, and that end of the bone, what we see is after birth some blood vessel is coming, and as the blood vessel come, it will bring some osteogenic cells and form what is called as the secondary center of ossification, not only this side but also that side. So you mean to say that the baby is born after birth, there is some blood vessel coming and bringing some osteogenic cells, now forming secondary center of ossification, not only at one end but the other end also? Yes. And what will that change into? Actually, that will later form what is called as the epiphysis. So there will be epiphysis on this side and epiphysis on the other side. So there can be multiple epiphyses which will come from the secondary center of ossification. But then as the bone is developing further, you'll find in the adult, this is the diaphysis, D for diaphysis. And what has happened to the growth plate? It has gone, disappeared, and it is M for metaphysis. So now the metaphysis has come and it has replaced the growth plate. As growth plate disappears, metaphysis comes. And what is this? E for? E is the epiphysis which would have come from the secondary center of ossification, not only this side but also that side. So it means that all the hyaline cartilage has been replaced by bone, endochondral ossification, but still you will find that this epiphysis or that epiphysis is still covered by some hyaline cartilage, and that hyaline cartilage which is at the ends of the long bones keeping them smooth for smooth movement at synovial joint is called as articular cartilage, and articular cartilage will never ossify. First of all, articular cartilage is usually made up of hyaline cartilage, and number two, it never ossifies. Number three, it will be compromised in osteoarthritis aging process. Number four, it does not have perichondrium. So these are some details which we need to know. Let's move on to the next thing, which is the structure of bone histologically. And when you look at the histological picture of bone, you will see, as you have taken a section here, there is endosteum on the inside lining the bone marrow. There is a periosteum on the external surface, and towards the endosteum you will have some cells, periosteum you have perichondrium. And there are some blood vessels passing. You know, the bone is a vascular structure. It has neurovascular bundle, and that neurovascular bundle is passing in the Haversian canal. As you say, the neurovascular bundle is passing in Haversian canal. We'll draw a diagram for that. But one Haversian canal keep communicating with other Haversian canal by what is called as the horizontal running structure, and that horizontal running structure is called Volkmann canal. There's a Volkmann canal. So Volkmann canal is connecting one Haversian canal with the other Haversian. Haversian canals run longitudinally here and here and here, and transversely they are connected by, horizontally they are connected by what is called Volkmann's canal, which will also carry neurovascular bundle. Now let us magnify this further. Concentric lamellae. Compact bone. Compact bone have concentric lamellae, and we have to magnify them. As you're magnifying this area of concentric lamellae, there you will have the bone cells. We want to talk about them. So we have magnified that area. It is here, and what you see is in the center you have the Haversian canal, and around that you have some concentric lamellae. What is in the lamellae? You have osteocytes in the lacunae. And there are some caniculi also, canaliculi also. What is there in the canaliculi? Actually, the processes of the osteocytes. And what is there in the central canal? In the central canal, we have the blood vessels. We are supposed to draw this diagram now. But before you draw this diagram of the bone, showing osteocytes in lacunae with canaliculi and the Haversian canal, all that, you have to talk about some cells like in the bone we have osteoprogenitor cell. Actually it is stem cell. So when there is a stem cell, osteoprogenitor cell, it is the one which is going to give us the next cell, which is called as osteoblast. And when you're talking about osteoblast, it is important to form the osteoid of the bone. So osteoblast is derived from the osteoprogenitor cell, and it is involved in bone formation, forming osteoid, bone formation, osteogenesis. And later when it becomes old, when the osteoblasts become old, it will be called as osteocyte. So Osteocyte is the older version of the osteoblast, and now it is not forming any bone. It is for maintenance of the bone. Osteocyte is for maintenance of the bone. It is not involved in osteogenesis. Osteogenesis is done by osteoblast. If you're talking about osteoclast, osteoclast is not a bone cell, it's a blood cell. If you say it is a blood cell, which blood cell are you talking about? Actually, several monocytes will come together and they form a multinuclear cell. So, several monocytes will come from the bone marrow, the blood cell, and they will form a multinuclear cell, which is osteoclast. It is for osteolysis, bone resorption. So, osteoclast is multinuclear cell and for bone resorption. This is what we have to remember. This is central canal and central canal. So if that is the central canal, what is inside the central canal? We have this artery, and we also have the vein, and we also have the nerves. So neurovascular bundle, yes, in the central canal. Actually, it is called Haversian canal. And how will you connect one Haversian canal with the other Haversian canal? That communication is called as the Walkman's canal. That is running horizontal and connecting one neurovascular bundle with the other neurovascular bundle. Bone is highly vascular structure as such. And what is around the central canal? The concentric lamellae. Now, if you say these are the concentric lamellae and bone is a lamellated structure, what is in that? There you see there are some osteocytes. And what is osteocytes? Osteocytes are the older version of the osteoblast. Now, these osteocytes you'll find they are in a canal. I'll magnify. These osteocytes in a canal, and that canal is sending canaliculi. I'll change the color. Canaliculi, canaliculi, canaliculi. So you are telling these are the canaliculi, small canals? Yes. And the osteocyte itself is in a large canal? Yes. It is called lacuna. So osteocyte is in a lacuna. Yes, this is the lacuna. And from the lacuna, what is going outside? Canaliculi, canaliculi, canaliculi. So this is the osteocyte. Yes, this is the osteocyte, but it is in a lacuna, and that lacuna is having canaliculi. What is this lacuna canaliculi for? For the diffusion of the metabolites. Diffusion of metabolites means what metabolites are you talking about? That could be, gases, CO2, O2, oxygen, carbon dioxide, or maybe nutrients. You want to carry nutrients. So the osteocyte will receive the nutrients and oxygen and send back the carbon dioxide through the canaliculi. Yes. That is the purpose. Where to it is going? Where should it go? Towards the blood vessels which are there. This is the artery, and that was a vein, and then there was a nerve. So you are telling that if you want to receive oxygen, then you need the canaliculi there. Yeah, that's the point. And what about the osteoclast? Osteoclast, if you are telling, you see they are multinuclear. And if you say osteoclast or multinuclear bone-eating cell for osteolysis, it is actually several monocytes together. Several monocytes come together and they unite to form a multinuclear cell that is called osteoclast for bone osteolysis. Now, as you talk about the differences between bone and cartilage, they have some similarities, but there are differences also. See, cells in the cartilage were called chondrocytes. They are in the lacuna. And here it is osteocytes in the lacuna. If you are talking about the matrix, then in the cartilage you have some chondroitin sulfates which are actually forming the matrix. Some hydrated proteoglycans to giving some rigidity and flexibility, whereas bone is basically calcium phosphate and calcium carbonate. Though there is some collagen fibers also, of course, but it has, it is calcification. So calcium phosphate and calcium carbonate in the bone. And when I talk about the fibers, of course, there are collagen fibers. Do you remember which type of collagen fibers are there in cartilage? It is collagen type 2, though not necessary because there was one cartilage which behaves like bone. What is bone collagen? It is type 1. So which cartilage has type 1 collagen like bone? It was fibrocartilage. So if you're talking about fibrocartilage, it is atypical cartilage because it has the same features of the bone, and if the bone is having type 1 collagen, even fibrocartilage has type 1 collagen. It has features like bone. But normally hyaline cartilage or the elastic cartilage should have type 2 collagen. And what about the vascularity? None. They are avascular. Not only they are avascular, but they are non-neural also. So that means the cartilage has no nerves and no blood vessels, but the bone has neurovascular bundle. Yes, but remember one more thing. Again, the fibrocartilage is atypical cartilage. Why would you say fibrocartilage is atypical cartilage? Because fibrocartilage has features of bone. It means it is having vascularity and it has neurovascular bundle also. So fibrocartilage is atypical cartilage and it is not behaving like the regular cartilage. Regular cartilage is avascular and it has no neural innervation inside, but fibrocartilage has nerves, it has blood vessels like bone. And what about the covering? Covering, we know that there is a perichondrium, but there is no perichondrium on fibrocartilage. Fibrocartilage don't have perichondrium. And what is bone having? It is having periosteum. Bone has periosteum. What about the regeneration capability? See, cartilage regeneration is very limited. And what about the bone? Bone has, if there's a fracture, what happens? It heals. But once the cartilage is gone, it's gone. So when you're talking about the bone, like a fracture is there, fracture healing is there. It will have extensive ability to heal itself, but the cartilage has limited ability of regeneration.